Welcome to this presentation on free flaps, which is the first in a series of presentations and videos on free flaps for OR staff. During this series of videos, I will review important tips on preparation for microsurgery flap cases specifically designed for OR staff. In this presentation, I will provide a brief overview of free flaps and microsurgery. There are lots of different types of flaps used in reconstructive surgery. Free flap surgery is a type of reconstruction using a patient's own tissue in which a flap with its own blood vessels from one anatomic donor site is transferred to a more distant recipient site where the defect or wound exists. The free flap is usually taken from a donor site with an appropriate type of tissue. Free flaps allow us to achieve sophisticated reconstruction of defects that are large, have tight skin, or limited local tissue available for reconstruction, areas that have previously received radiation therapy, or complex wounds that require multiple types of tissue for reconstruction. In the case presented here, reconstruction with a free flap allowed us to achieve limb salvage in a patient who might otherwise face amputation of his leg. Microsurgery is a specialized discipline of plastic and reconstructive surgery that uses advanced techniques, including an operating microscope, to perform intricate procedures on small blood vessels, nerves, and lymphatic vessels. During free flap surgery, in order to keep the free flap tissue alive, we use microsurgical techniques to disconnect the flap from its blood supply at the donor site and reconnect it to new blood vessels at the recipient site. First, blood vessels near the recipient site where the flap is needed are evaluated and prepared. Next, the free flap and its blood vessels are prepared at the donor site. The free flap is then disconnected from its blood supply and moved to the recipient site where it's connected to an artery and vein to give the flap blood flow, keeping the transplanted tissue alive. The free flap artery is connected to an artery at the recipient site using a surgical microscope and sutures that are thinner than a human hair. This artery provides the free flap with blood flow to keep it alive. Since free flaps depend on one artery to provide oxygenated blood to the flap, it's very important to make sure nothing interferes with blood inflow or the flap can die. Compression on the flap or formation of clots in the flap artery can compromise blood flow to the flap, so we closely monitor the free flap after surgery and may use a variety of medications to thin the blood. The free flap vein is typically connected to a recipient site vein with this device called a venous coupler. The venous coupler device has two silicone rings with small pins which connect these veins together. A small Doppler probe may be attached to this coupler, providing an audible signal of vein outflow for monitoring during and after surgery. This vein removes blood from the free flap to keep it from becoming engorged or congested with blood. Since free flaps depend on one or two veins to remove deoxygenated blood from the flap, it's very important to make sure nothing interferes with blood outflow or the flap can die. After the microvascular anastomosis of the artery and vein, the free flap is inset or attached to the defect with sutures while closely monitoring blood flow to the free flap. Since free flaps get their blood flow from only one artery and one or two veins, it's very important to make sure nothing interferes with blood flow, such as compression of the flap or a blood clot in the flap vessels. After surgery is finished, the free flap is closely monitored for problems with blood flow into or out of the flap with a variety of techniques and monitoring methods. Ultimately, these advanced techniques in reconstructive microsurgery and free flaps allow us to provide surgery and reconstruction to cancer patients who may have previously been told they had no surgical options, achieve limb salvage in patients facing amputation, and improve patients' quality of life and longevity. Thank you for watching this presentation on free flaps. Please stay tuned and follow for more presentations and videos on free flaps for OR staff.